Hey guys, this is Dr. Hub. Today we look at the characteristics of the medical gas cylinders. Characteristics of the medical gas cylinders. So what does it include? First we start off with the oxygen. Oxygen. So how is oxygen? Oxygen, there is a black body. So oxygen, there is a black body, and then there is a top shoulder. The shoulder remains white and the body is black. The body is black, the shoulder remains white. So this is the case of the oxygen, and this is the color coding in terms of India. So in different countries there can be a different color coding, but in India this is what is followed. So the oxygen, the base, the body is black, whereas in case of the shoulder is white. So what is the capacity? So we'll also look at the E-cylinder capacity. So here the unit we are going to look at is L, that is a liter. So it is 625 to the 700. And next we also look at the pressure, that is a P, and this will be in the PSIG, and this is at 20 degrees Celsius. So the PSIG is nothing but 1800 to the 2200. This will be oxygen. Next we move on to the nitrous oxide. So nitrous oxide is nothing but it is a liquid. So here do we see that everything is blue. We have a shoulder, we have a body, so everything which appears is blue in color. So the color is nothing but blue. Now what is the E-cylinder capacity? The capacity is 1590. So 1590 is the E-cylinder capacity. So it is very more compared to that of the oxygen. So what is the pressure? Pressure is nothing but the PSIG. So the pressure is nothing but it is 745 is the pressure. So it is at PSIG is at 20 degrees Celsius. Next we will focus on the nitrous oxide. Let's erase this. Next we are going to look at the nitrous oxide. So we already saw the nitrous oxide, it was in liquid. Liquid is blue. Yes. And then we look at nitrous oxide. Nitrous oxide, we have a shoulder, we have a body, so everything looks black. This is the nitrous oxide, so everything is black, and the E-cylinder capacity, it varies from 625 to the 700. And what about the pressure PSIG at 20 degrees? So the pressure at 20 degrees, PSIG at 20 degrees Celsius, so this is nothing but it is 1800 to the 2200. Next comes the air. So how is air identified? So air or the gas. We are going to looking at the air or the gas. So in terms of air or the gas, the body. First we look at the body. So if you look at the body, it can be either black or it can be grey. It can be black or it can be grey. And looking at the shoulder is either white or black. So the shoulder is either white or black, whereas the body it is grey or black. So this is about the cylinder of gas or air. So the E-cylinder capacity here is nothing but 625 to the 700. Then what about the pressure? There is a PSIG, it is from 1800 to the 2200. Next we move on to the NOx, the gas NOx. So NOx gas, so this is nothing but it is white and blue. So what do I mean by white and blue? So let's draw. We have the body, we have the base, that is the body and the shoulder. The shoulder is, it can either be white or blue. Shoulder is white or blue, and the body is completely blue. So if you look at a completely blue cylinder, it is nothing but it indicates a NOx. So this is completely blue. So this is nothing but the NOx. So let's talk about the E-cylinder capacity. E-cylinder capacity is nothing but 625 to the 700. This will be in liters, and then the PSIG at 20 degrees Celsius is nothing but 1800 to the 2200. So this was about the medical gas cylinders. To learn and grow daily like this, please do subscribe.